expenses at the minimum for health care in retirement. And then add to that, of course, the things that Medicare does not cover, like vision and dental and hearing, and among other things. And then, of course, those supplemental policies to Medicare. Since it's never designed to do the whole job, people are always going to have to look for some kind of supplemental coverage, whether it's a Medicare Advantage plan or a Medigap plan. And clearly, those premiums are going to be very variable around the country. I put up here $1,800 a year as a very average and conservative cost for a supplemental plan on an annual basis. So if you were to add up all those minimal out-of-pocket expenses at the low end, we're looking, if you didn't even have a hospitalization in a given year, at the low end, just getting those minimum coverages in place, about $4,500 a year per person. At a higher end, if you use more prescription drugs, probably about $10,000 a year per person. This is just to have coverage. This isn't really all those cost shares on top of it. So are people really planning for that? That's per individual. Take a couple, you're looking at twice that amount. And then long-term care. Long-term care is certainly one that is clearly visible in especially the baby boom generation today, not only because they're entering retirement right now, but they're still caring sometimes for older parents who are already experiencing the long-term care needs. And sometimes you can self-insure for that, and sometimes you might actually be better off to go ahead and purchase a policy. Being very careful about the level of coverage and affordability of that coverage ongoing. So when we do talk about the estimators for health care coverage in retirement, and this does come from an EBRI study, Employee Benefits Research Institute, from about a year and a half ago, it is going to depend on your particular health care situation. Clearly it will be variable, but just as an eye-opener, an age 65 couple today would, with an average life expectancy, who has maybe a median level of usage of prescription drugs, maybe before you ever get to that proverbial donut hole in the Part D coverage, will need about $158,000 over their life expectancy to cover those out-of-pocket costs. That's if they want a 50-50 chance of not outliving those assets. If they don't like those odds and they want to be a little bit more comfortable or confident, if they wanted to have more of a 90% chance of covering their expenses, they need about $231,000. And then if you look at coverage for prescription drugs that go beyond the median level, then you're looking at $271,000 versus $391,000.